The following segment is sponsored by Moda Health.
Welcome back to AM Northwest. After 14 months of taking pandemic precautions, many of us are getting ready to get back to the activities we used to enjoy, whether it's hanging out with friends or just going to the office. Here to share some of the mental health challenges coming out of quarantine, we welcome back from Moda Health, Senior Manager of Behavioral Health, Dan Thoma. Hi, Dan.
Hi, Helen. Thanks for having me back.
You bet. So we've faced a lot of challenges during this time, right? So what have those challenges caused?
Well, those challenges have really caused a lot of disruptions to our normal routines. So you think, for example, of parents who are trying to manage their children's education from home, either while they're trying to work from home simultaneously in the next room, or they may be having to go to a workplace somewhere else where they're being exposed on a daily basis to this dangerous virus and having to sort of do that shuffling and worry about what's going on. Or perhaps you've lost your job and are dealing with just trying to make ends meet. So it's pushed a lot of us really into survival mode.
Yeah. So what has been the impact then of survival mode?
Survival mode really does a number of things to us. One of the things it does is it disrupts our habits. So we have typically a pretty healthy routine established. So I, for example, have a morning exercise routine that I haven't done for months now, and it's not.
Oh, I hear you there.
But I'm just not doing it.
Right.
We instead of those things, we'll turn to less healthy habits. We may be drinking more alcohol or using more other drugs. And it also really affects our thinking. Our thinking becomes more rigid. Our problem-solving abilities go down and we become more reactive. So in a lot of ways, when we're in that survival mode, we're really not our best selves.
So now that the CDC guidelines have been relaxed a bit, we're getting vaccines and all of that. How do you think that will affect us?
I think it's going to be all over the place. You'll see a lot of elation and relief and joy at the ends of all these restrictions and being able to go back and see people and do things. There's also going to be a lot of anxiety associated with that. People may have fearfulness of sort of, coming out of the shells that we've been in for over a year. There's going to be a lot of grief too for the old lives that we've lost, for milestones that we've missed during this time. And we're really going to have to rebuild our lives, and that can be stressful for folks.
Let's talk then about how we prepare for the new world. Maybe a little bit of COVID situation, but we do have a new world coming around the bend here. How do we prepare for that?
We do, and it's really going to be an opportunity to reevaluate. So one of the things that COVID has done is, by disrupting our normal routines, has given us a chance to view things differently. And just a silly example of that is the commute. So some people have found that if they're working from home, that they love having 2 hours back in their day.
Yeah.
Other people have found, wow, I really missed that transition time. And so it's going to give us really that opportunity to start to rebuild in a way where we can be thoughtful and mindful about, what are the things that I want to do differently? What are the things that I want to do more of as we sort of create these new lives for ourselves?
And you suggest talking to a mental health therapist?
That can be really helpful, particularly if you're feeling overwhelmed. There's been a fourfold increase in the number of people who are reporting clinical symptoms of anxiety and depression during the pandemic. And so therapy can certainly be extremely helpful with those things. Or if you just don't sort of know where to turn next. And there's a lot more options for that now.
Yeah.
It's available by video, sometimes even by chat, as well as in person.
Absolutely. We want to tell our viewers, if you would like to find out more, you can go to modahealthminute.com for more information. Dan, thank you so much.
Thanks, Helen. It's a pleasure to be here.
We'll be right back with more AM Northwest. Don't go away.